Hello, everyone. My name is Dan Toner. I'm the health insurance agent for TESA Manpower and all the subsidiaries of TESA. Today, I'm introducing or going over the September renewal for 2021. This is open enrollment in August. And actually, if you're a new employee, this is the time to understand the plans that are available. My company, FFP Benefits, our website, by the way, is www.ffpbenefits.com. And that's where you can reach me, Dan Toner, and my staff. But we're here to help explain the plans that TESA and the subsidiaries are offering for medical, dental, vision, and the life and disability. So on the screen, I'm just going to get rid of my face for a second and show you a couple of different things. All of the coverages, I'm going to go over them and show you our portal called My Benefit Link and explain how you can simply enroll once you're hired. Once you have a renewal every year, you'll be getting a link to simply click on, and I'm going to go over those screens so you can make your elections. That basically is going to communicate to my staff, and then we'll work with each insurance company to make sure you're covered. Okay, so just going to get rid of my face for a second. So in terms of the medical coverage, we're offering 3 plans from Horizon Blue Cross Blue Shield, the Omnia Silver, the Omnia Silver with Blue Card, and the Omnia Gold. What's most important is the way that Horizon works, their Omnia portfolio, is that you are given 3 different plans. Within the Omnia platform, there's 2 levels of coverage, Tier 1 and Tier 2. So for example, if you go to your PCP, primary care physician, if you're seeing a Horizon Omnia Tier 1 provider, you would pay $30. The deductible is waived, meaning you don't owe the entire $1,300. You would just pay your copay. Now, if you happen to go to a Tier 2 provider, you owe 50% after the Tier 2 deductible, which is $2,500. So both are covered, but you'll get a lot richer coverage if you use Tier 1 providers. And if you go to horizonblue.com and you click on the Find a Doctor, you can easily find all of the providers that they list as Tier 1 or Tier 2. This is our current plan. We're going to offer 2 additional plans this year. Most people are in the Omnia Silver because there's a lot of Tier 1 hospitals, doctors, providers. Keeping with that incentive going, if you go to a specialist, you'll pay a $60 copay if it's a Tier 1 versus the deductible and 50% for Tier 2. If you go to the X-ray and lab work and you're using Tier 1, you owe $0. If you go to the pharmacy, you owe a $20 copay for generic. You have a $250 deductible and 50% coverage for name brand. However, you won't pay more than $250 for that name brand. So in case the drug is $1,000 or $2,000, they don't want you paying 50%. That is new. They did not have that $250 protection in there last year, so that's new starting September 1. Now, the rest of the plan is going to address major bills like, let's say, hospital, surgery, MRIs called imaging like CAT scan, PET scans, MRIs. If you're using a Tier 1 facility, you would owe a $1,300 deductible, and then that deductible is done for the calendar year. And then if you went for outpatient surgery, you'd owe a $250 copay. If you went for an MRI, you'd owe a $100 copay. And if you're in the hospital, you owe $500 per night, but after the 5th night, you don't owe any more. So your worst case scenario on an admission would be $2,500 if you stayed more than 5 nights. Now, again, you would owe $2,500 plus 50% if you went to Tier 2, so you're incentivized to choose Tier 1. Most important number is called the maximum out of pocket, and what they're basically telling you is that no matter what your coverage is, the most you'll owe every calendar year is $8,550. Now, if you're using Tier 1 facilities and doctors, it's very difficult for you to hit the $8,550. Most people don't come near it. But if you're going Tier 2 and you owe $2,500 plus 50%, you may hit that $8,550 quicker. So again, the plan is incentivizing you to stick with Tier 1 providers. The middle plan is called the Omnia with Blue Card. And Blue Card is a concept that means you can see doctors Blue Cross providers outside of New Jersey without an emergency. If you notice on the first plan, you have emergency coverage if you go out of network and even out of state, but you need an emergency. With the second plan, while you don't have out of network, you just have to make sure your doctor accepts Blue Cross, but you can go out of state. So the blue card says, I want to go to New York and see all of the Anthem Blue Cross, or I want to go to Philly and see all the Independence Blue Cross, or go to Connecticut and see the Anthem Blue Cross. You can do that, but you would be at the tier 2 level. Now, to beef up the plan, they give you a copay now for tier 2. So there's a $40 copay if you go tier 2. Still incentivizing you to use the Jersey tier 1, but at least they're giving you better coverage for doctor visits and a little lower deductible. So those that want to go exclusively out of state may want to pay a little extra premium and get the blue card. The third plan is no blue card, so it's the same concept as the first one, pretty much New Jersey only providers, but a gold is going to owe lower copays to the doctor compared to the silver, lower copays to the specialist compared to the silver, and obviously lower deductibles and out-of-pockets. So for those that expect a lot of bills, you may want to pay extra premium to Horizon and upgrade to the gold. Okay? The dental plan is renewing with 0 increase, so the costs are staying the same. It is with Delta Dental. If you use the Premier Network, you have a $2,500 maximum benefit you get every year for you and every dependent coverage. So if you're covering you and a spouse, you get $2,500. They get $2,500. If you're covering children, everyone gets $2,500. If you're using the PPO network, which is a little smaller network than the Premier, they'll bump it up and give you an extra $500. And the way dental works is they have 3 levels of coverage. Your preventative care, you can see on the screen what that is covered at 100%. You owe 0. Your basic care, you can see what that is covered at 80%. So you'd owe 20%. And your major services are covered at 50-50. Again, when Delta pays out either the $2,500 or the $3,000, you're done. And then when you wake up on January 1, you're getting a fresh new maximum for the year for every person covered. And again, no increase on the dental. So we decided to renew that for September 1. And the renewal is 0% increase for the vision, which we have with Blue Cross Blue Shield, called the Panorama IVB voluntary product. You can see at the bottom these monthly premiums. By the way, they're going to be broken out by payroll for you, but they are the same for the year. If you're covering yourself, spouse, you and children or family, there's 4 tiers. That's on our portal for you to see. And again, the way that there's 0% increase, the way that vision will work, it's sort of a combination of a copay when you go see an eye exam and a copay for lenses, and then a cash reimbursement. So one thing to keep in mind about vision is if you have a medical condition, it's covered with the Blue Cross medical plan, the Omnia. If you need a well visit, it's not covered under medical. You need a vision plan. So your annual checkup, your glasses, your lens, all that reimbursement, you need a vision plan to do that. Otherwise, it won't be covered for the medical. So what they're saying is every year you can have an eye exam and pay $10 for just a checkup. Every year you can get lenses and you'd pay $25 for the frame and you'd get a cash reimbursement of $130 plus 20% off. So, and you can do the frames once every 2 years and contacts every year. So it's a combination of sort of a copay and a cash reimbursement. Last thing I'm going to show you is you got an email to when you were first onboarded, or for every open enrollment like this year, you got an email from My Benefit Link, which is my software welcoming you. So you'll click the Start Registration, and then the site will bring you to, just give me 1 second, it'll bring you to a screen that sort of has you taking 8 different steps, very easy. You'll set up your account with your own password. Take a look on step 2 to make sure your address, spelling, home address, social, all your personal information is correct. Take a look. If you're adding dependents, our site will let you quote them in the as a single or adding them. So make sure you add dependents if you have them. Doesn't mean you can cover them, but it means you can get a price for them. And then you'll start the enrollment, and the enrollment's on one page, and here's what it'll look like. The 3 medical plans are there. You can click compare, and it'll show the 3 of them together. You can click info for a little more information. And by the way, the full-blown 10-page summary is right there. And you'll click modify, and then you'll see whether or not you have dependents or not, and it'll give you a price. You can click to enroll or to waive, and then you'll move down to Delta, and our site tried to list what you have today, and you can modify it because it's open enrollment. With the vision, dental, and medical, we tried to match how you're covered. Everyone is covered for the life insurance for Unum, and there's a cost of $1.85 per paycheck, so everyone's enrolled under the life. The disability is, I'll just pull up the benefits. You have a 90-day waiting period, and then you're covered. 60% of your salary is covered up to $6,000 a month. That is paid for by the company, and you can see employer paid, so there'll be zero cost. The summary sheet will then tell you how much you owe per paycheck. You'll hit next and follow through all the way to the steps. You can add your beneficiary. You can sign with a mouse or your finger, and then you'll be asked to click summary, and you'll be wrapped up and enrolled. Anne Marie and I will then get a summary, and we'll make sure those changes happen for September 1. If you're a new employee, we'll get an email after you enrolled, and my team will turn in all the applications and waivers. If you're waiving coverage, this portal will collect your waiver, so we don't have to collect paperwork from you. Okay, so any questions? Our office, by the way, is 732-888-5554. I gave you our website. Again, my name is Dan Toner. Welcome to TESA Manpower and all the subsidiaries, and have a great day.